When you have a child that is sick or in pain, you want the most competent, caring help available, and that's exactly what you'll find at TMH's Children's Center. Tallahassee Memorial has the largest number of pediatric specialists in the area, and it's also home to the only pediatric ICU in the Big Bend region. But what truly sets them apart is their commitment to making even their youngest patients feel safe and comfortable.
We do understand that being hospitalized is very stressful for children and their families. So in an effort to make it less stressful and anxiety producing, we create an environment that's very loving and calm and colorful.
The Children's Center is really such a special area of the hospital. Would you mind giving me a tour?
Oh, absolutely. Right now we're standing in the Pediatric Intensive Care Unit. We're the only pediatric intensive care unit in the region. We have a 10-bed facility. We also have a 26-bed pediatric floor, and we have a treatment room where we take the children for special procedures. Nothing painful is done in their rooms. We also have a playroom for the children. It provides distraction throughout the day. Fun toys, games, arts and crafts. We also have a Ronald McDonald room for the families of hospitalized children where parents can go and get away, get on the computer, watch some TV, take a break from the bustle of hospitalization.
So what are some of the treatments you're able to use to make your patients feel more comfortable while they're here?
Well, we have a number of things. We have a little vibrating device that looks like a bumblebee or a ladybug, and it's placed on the skin and vibrates, and so it interrupts the pain signal. And we have this wonderful machine called a Vecta machine. It has colors and lights and sounds and tactile devices that children can use when they're getting poked, and it makes the perception of pain less stressful for children.
Now tell me a little bit about your child life specialist, because that's kind of unique in this area.
Child life specialist is so critical to everything that we do here in the Children's Center. She is our one voice. She comes in to the treatment room or any sort of procedure that a child is going through or a test that they're going to have, and she explains it to the children and the family in terms that they understand so that going through the experience is not as stressful.
All right, now it seems to me like TMH is very committed to providing the best possible care. So can you kind of describe a little bit the team here?
Family-centered care is very critical to what we do. We understand it's not just the children, it's the families that we're treating. So the nurses, the child life specialists, our PCAs, our nurse managers, our respiratory therapists, everybody is very committed to creating a calm, caring, loving environment for the children that are sick.
Here at TMH Children's Center, we have a wide array of pediatric subspecialists, all coming together to help a specific patient's needs. We have pediatric cardiology, endocrinology, infectious disease, neurology, nephrology, just a wide array of doctors that can all come together. We're very lucky to have the region's only pediatric ICU. Here at the Children's Center, we can treat things such as pediatric trauma, snake bites, asthma, children with complications of diabetes, just a wide array of diseases.
Peyton decided that she was going to go down the stairs in our house in a storage container. As soon as we saw her, we knew that she had broken her arm, so we brought her to the ER. She ended up having to have surgery right away, and then we came here to the Children's Center. She was very scared coming out of surgery, and they were really good to her, and they explained things in ways that she could understand. I was very confident in the nurses and the team that came in and took care of her.
My favorite part was how everybody was so nice to me.